Hi everyone, I'm Teona Ducre, here with you today during Black History Month to lead an important discussion on behalf of PanCAN about pancreatic cancer and the Black community. I am so excited to host this webinar and spread the word about PanCAN. Thank you for being here. PanCAN has been so important to me during my own journey. I am a 6-year pancreatic cancer survivor. Like so many, I experienced vague symptoms that were misdiagnosed. Doctors thought the severe stomach pain I had been dealing with was from an ulcer. I was young, barely in my 40s. Pancreatic cancer wasn't considered a possibility. But at 41 years old, on April Fool's Day in 2016, I learned I had stage 3 pancreatic cancer. I was a single mom of 2 teenagers. I didn't know anything about pancreatic cancer. Thankfully, I found PanCAN right away. They were a lifeline. I spoke to a patient services case manager who helped me find a pancreatic cancer specialist and understand treatment options. Later, in my diagnosis, PanCAN also helped me navigate genetic and biomarker testing. After rounds of doctor's appointments and scans to determine if the cancer had spread, I had chemotherapy to shrink the tumor and then surgery. Fast forward to today. I am grateful to be able to say I am now cancer-free and doing well. I became a volunteer for PanCAN because I am so thankful for the critical support I received. I want others affected by pancreatic cancer to know the free services PanCAN provides to patients and families. I want everyone to be empowered, to be an advocate for themselves, for their families, for their community. This is an important message during Black History Month because we know that Black Americans are more likely to be diagnosed with pancreatic cancer than any other racial or ethnic group. There will be a lot of information provided today, so know that if you're a patient or caregiver, PanCAN Patient Services is available to you via phone and email, Monday through Friday from 7 a.m. to 5 p.m. Pacific Time. If you have any questions, you can speak with the PanCAN case manager who can help. I'd like to take this opportunity to thank PanCAN's generous supporters, many of whom are on today's call. Also, a special thank you to Ipsen, our webinar sponsor. And thank you to our scientific and medical affairs industry members, AstraZeneca, Cornerstone Pharmaceuticals, Fibrogen, Immunovia, Ipsen, Mirati Therapeutics, Novartis, Novocure, and ViewRay. PanCAN supporters are helping create a world where all pancreatic cancer patients can thrive. To learn more, visit pancan.org. So now, I am excited to introduce you to our panel of very special guests. Fabienne Ayave is a licensed genetic counselor at Emory Winship Cancer Institute in Atlanta, Georgia. I know her well, and I am grateful to be her patient, and I am so happy to have her here today. Dr. Edith Mitchell is a clinical associate professor and the Enterprise Associate Director for Cancer Disparities and Program Leader for Gastrointestinal Oncology at Jefferson Health in Philadelphia, Pennsylvania. Rod Williams is a member of PanCAN's Board of Directors. A native of Grapevine, Texas, he became involved with PanCAN after he lost his brother-in-law to pancreatic cancer in 2017, just 3 months after being diagnosed. And we have Fatima Zalata Arenas with us today. She is PanCAN Patient Services Director of Research and Education. Not only does she speak with pancreatic cancer patients and caregivers, She leads critical scientific and clinical initiatives for PanCAN related to health equity. Thank you all for being here. Let's get started. Dr. Mitchell, Black Americans are more likely to get pancreatic cancer than any other racial or ethnic group. Why is that? And how can we address this disparity?
So we really don't know why. One of the areas is related to our studying the precision medicine options that we've had the last few years. And we have found some genes that might be important. And also, some of the genes may actually have originated during the slave trade, where individuals from West Africa that we know those genes are now still in individuals from West Africa and are important. And it may have been important for survival from various disease processes like sleeping sickness and others. So we don't know. And the important thing is studying all of the genetic and genomic processes in patients. And it's well recognized that African Americans and other individuals from racial and disparate ethnic communities don't have access and are not offered access also because of bias, such that we don't know. And I think the important thing is for every pancreatic cancer patient, whether they are in center city or red-lined areas, rural, or whether they're in communities where there is a lack of access, that these individuals should be offered the opportunities for genetic and genomic profiling, such that we know not only the background of the individual, but also what are the genomic alterations in the cancer, so that we understand and know how we can offer the right therapeutic intervention to the right patient at the right time. So we've got a lot to do in terms of providing access to care and access to diagnostic testing in disparate communities, such as the African American.
Yes. So I'm particularly passionate about awareness. So many patients experience, like I did, incredibly vague symptoms that can lead to a late diagnosis and definitely impact patient outcomes. I'd love for you to talk through some of the signs and symptoms of pancreatic cancer and address why community education and awareness of the disease is so important in the Black community.
Absolutely. It is very important that education in the community be a major effort. There are no specific signs and symptoms of pancreatic cancer. By the time most patients reach the medical community, they already have advanced disease. And that can be sometimes 90% of patients will have advanced disease by the time they are diagnosed. Number one, there are no preventive aspects that we know about. There are no factors to search for prior to diagnosis. There are no screening tests that we can utilize for early diagnosis or even diagnosis of early stage changes that could potentially lead to pancreatic cancer. So, unlike, for example, cervical cancer or colorectal cancer, where there can be screening over many years to try to make a diagnosis early prior to the patient developing um, advanced symptoms. Most patients, by the time they reach the clinicians and the healthcare system, there is either a lack of appetite, pain, fatigue, and other non-specific symptoms such that we don't have tools for early diagnosis. So now there are research areas evaluating circulating um, RNA or DNA in the bloodstream to try and screen for pancreatic cancers. Those studies are early and we don't have answers to them at this time. So therefore, I encourage individuals to look for clinical trials in these areas. I encourage institutions to do community outreach to individuals and the specific communities in their catchment area to therefore provide patients with not only education and information, but access to clinical trials. Another area that may be opportunities for us. Have you heard of the All of Us program?
In fact, I have. I am part of that program through Emory
Okay.
Winship. So, yes, thank you for bringing that up,
Yes.
actually. Can you tell us a little bit more about
With
it?
All of Us, with All of Us program, this is the largest program that NIH has embarked on. And it is a plan to collect data, clinical data, as well as tissue from over 1 million individuals. And this program started in May of 2018. And at this time has over 500,000 participants already. And we're searching for more. But an important factor for all of the program and the education about it is that the information will be given back to the participant. And notice I didn't say patient, I said participant. And with that, it is likely that we can find information regarding at risk for the participants. So, what disease processes that an individual may be at risk for, and therefore there may be the opportunity for early intervention. So I'm really excited about this program, and it is now beginning to accept research proposals and not only for cancer, but for other chronic conditions, Alzheimer's, diabetes, hypertension. And with this information, the participant may be able to work with their physician and clinician sources to help define the risk of developing various disease processes. So I'm really excited about All of Us. I encourage participation in the program. And I'm now encouraging researchers to think about and develop proposals. So yes, I'm very um, interested in all of us. And on the day that it was launched, I believe it was May 6th of 2018, there were many of us on the speaking circuit that day, um, giving education and information about all of us.
That is incredible news, and thank you for sharing the All of Us program. I happen to be a participant in that, so I'm excited to hear from you, Dr. Mitchell, that that program is doing well and encouraging participation in it. I want to talk a little bit. We've talked about patients, but now I want to talk a little bit about healthcare providers. We know how important it is for patients to trust their healthcare providers. In the face of past abuses and systemic racism, what can healthcare providers do differently to help serve Black patients?
Sure. So that's a great question. And one of the things that we have to evaluate is the fact that many individuals from disparate communities, racial and ethnic minority patients don't have access for routine health care, and therefore utilize the emergency room as the major area for healthcare when there is an abnormality. So many individuals talk about the Tuskegee incidences and the fact that routine healthcare is not available, whether because of redlining, and in redlined neighborhoods, there's a lack of drugstores, a lack of supermarkets, a lack of healthcare institutions, so that there's no close area for them to obtain medical care. So my suggestion is the healthcare institutions should know the community, know the nearby communities, such that they know what is missing and what the opportunities are. And that engenders trustworthiness. Many people will say, well, these communities don't trust. It's not the communities, they want to trust. They want medical care. We just need to find out, what are their needs? Are there sources nearby? So one of the things we're doing at Jefferson is we have a mobile van, and we know where there is a lack of access. We know what the needs are, and we work with the community to bring those efforts into our plans. We also try to make sure that the volunteers and the navigators are paid, so that we need to encourage our healthcare institutions to provide resources to the navigators, so that we see the navigators as extensions of our healthcare institutions, and thereby that increases our trustworthiness. So I think we have to get away from the nomenclature of saying these communities don't trust. That's not the issue. The institutions of healthcare have not gained and not provided those resources that influence trustworthiness. So we need to move toward developing those ideas and those processes that encourage trustworthiness of the institution. So we need to work with this and quit saying that the communities don't trust.
That is such a great distinction. I want to go back a little bit. You mentioned clinical trials previously, so we just wrapped up Clinical Trial Awareness Month at PanCAN. Why is Black representation in clinical trials so important, and how can an organization like PanCAN help to address this challenge?
Well, thank you. That's a loaded question. What I think we can all do, and I say PanCAN has worked with institutions and clinical trials over a long period of time, and I've been a part of that. So what we have to do is make sure that we have the collaborative, that we provide the information, that we develop collaboratives with clinical organizations. The African American physicians, for example, are very interested in what we do. And one source can be getting that clinical trial into the area. We also need to work with patients and find out what will allow them to participate in clinical trials. It's well recognized that African Americans have a lower socioeconomic level than most other majority institutions, so that for some patients, if there's not adequate access in their community, and they have to come into an institution for that clinical trial, individuals, it's not just the patient too. A family member might have to take off work, bring the patient into the location for the clinical trial. And with that, that affects the economic stability of the family. Parking, expensive. So we need to develop methods of assisting the patients with those entities that affect family structure and family finances. That's one area. Another area is bias. And patients say, in patient-reported data, where patients are asked why did they not participate in a clinical trial, what the patient said was nobody asked. So we've got to make sure that we provide that information. Other information, again, from patient-reported data, we recognize that African American clinicians account for less than 5% of practicing clinicians in this country. So even though a patient might request a clinician where they have similar characteristics and background, we know that there are not enough Black physicians, for example, for Black patients to all have a Black doctor. While research has shown that Black patients who have a Black doctor have better outcomes. So we need to address the bias that occurs in our healthcare system. So again, that patients feel the trustworthiness of the clinician and the institution.
Rod, can you tell us a little bit about your connection with pancreatic cancer and how you came to be so involved with all of the important work that PanCAN is doing?
My late brother-in-law was suddenly diagnosed with stage 4 pancreatic cancer, which came upon suddenly, which left my sister both devastated and at a complete loss of what to do. And what clinical options were available to treat. And as a result of subpar clinical support from their primary care physician, to my knowledge, the family had no counseling or guidance on how to deal and manage with a fatal disease like this. So as someone who's been in the medical field for 20 plus years, mostly in cardiovascular disease, I too was uninformed and not able to provide any value, which was both frustrating and felt extremely handicapped.
Thank you so much for taking time to answer that question, Rod. And my heart certainly goes out to you and your family, because I know how devastating a loss like that is, in particular when it's so sudden. So as a pancreatic cancer survivor and volunteer for PanCAN, I have seen the value of coming together during times of hardship. How does the PanCAN community give strength to those faced with such a diagnosis? And how can others get involved?
Yeah, most importantly, I think it's the stellar performance of PanCAN's ecosystem, and particularly their patient services team. It's an incredible network of staff in place to provide critical information on available options, access to providers, clinical trial information, which is not readily accessible at times, particularly in uninformed communities, and access to a network of survivors and caregivers who are capable and competent in sharing valuable information to both comfort and provide support for patients and their families. And having a support system of caregivers, family, friends, healthcare professionals, and a patient advocate is just important to address and manage the needs of this patient population.
Absolutely, and those are all wonderful points to bring up. So as a member of PanCAN's Board of Directors specifically, what efforts do you see PanCAN making to address health equity in the Black community? And more importantly, maybe what excites you most about this work that's being done?
Yeah, I'm really passionate about it. I mean, that's part of the reason why I joined PanCAN, because its mission and its recognition of trying to serve underserved communities. And I'm excited that to see PanCAN increase its educational outreach efforts in the Black and Latino communities. Because equally, I anticipate that PanCAN's continued focus on exploring the increasing needs of this complex disease and needs and delivered in the communities is extremely important. Many of these patients in these communities have undertreated behavioral conditions, as well as unmet social needs, further complicating gaining access to vital services and preventive measures. But some of the programs like early detection initiatives, Precision Promise as a potential roadmap towards clinical trials with promising new options creates a whole new opportunity for them. And I strongly believe that many of the initiatives that PanCAN continues to fund through grants, advanced research, et cetera, is contributing to the consistent increase in the survival rate for patients who are diagnosed with pancreatic cancer. And then lastly, what's really, really exciting for me is the continued commitment from our volunteers, donors, and industry partners that enables PanCAN to continue to support the innovation, growing and improving the health outcomes and quality of life for patients who suffer from pancreatic cancer.
And all of that is so important. And again, as somebody who's been advocating for the last 6 years as a survivor and just being a Black woman, everything that you said, I can completely agree with, because I share that same passion for our advocacy to see the Black community increase and have better outcomes. So Rod, thank you so much. Fabian, I've learned so much from you during the time that I've known you and that we've worked together, including just how important genetic counseling is. So for those who may not be familiar with your role, can you tell us what a genetic counselor actually does, and why is this work important?
Absolutely. So genetic counselors are part of the healthcare team, and they are trained in both medical genetics and counseling. They may specialize in prenatal, pediatrics, cancer, and other areas. And I specialize in cancer in particular. So I'm what we call a cancer genetic counselor. So what we do, we really help patient understand, patient and the family understand the implication of genetics to the disease. We help also assess the genetic risk based on the family history and the personal history. We see patients, they come to us, they have an overestimate of the risk. So the counselor will provide a risk assessment to give them a more accurate estimate of that risk. We also discuss if genetic testing is appropriate, or who in a family is the most important person to test. We discuss the result, what it means for the patient and the family, and provide also emotional support and help them cope with the psychosocial part of it. So we do all of that. We also talk about insurance and billing, discriminations, and the genetic counselor does all of that through the genetic counseling session. So it's a very important process for anyone who's interested in genetic testing.
Fabian, thank you so much. What you said about the emotional support, insurance questions, I'm sure that so many people don't even know all of those things fall under the umbrella of how a genetic counselor can help them. So thank you. But can you tell me what the difference between genetic and biomarker testing is? And should patients have both?
Yes, so biomarker testing is also called tumor testing or tumor profiling. It's a test that helps understand what makes the cancer grow. And also the biomarker test can, look at the protein in a tumor, the hormones in the tumor, the genes in the tumor, or other substance. But I will focus more on the genetics of the tumor itself. So biomarker tumor, looking at the genetics, look at genetic changes that are specific to the tumor itself. So think of it as a driver in a car. It controls how fast the tumor goes. So biomarker tumor help your provider predict how fast the tumor will grow and how likely it is to recur. It also help guide treatment options or treatment choice, or avoid toxicity. So if you have a genetic mutation or change in your gene, that particular change can be tailored to a particular specific drug. So your doctor is more likely to give you that drug versus another one. Okay. So in some biomarker testing, help patient and the doctor make informed decision about the best treatment for that tumor, for that cancer. But tumor testing, genetic testing, look at the genetic changes that someone was born with. They inherited from the parent and can also pass it on to the children. So genetic testing inform about trait or inform about cancer risk. So both tests look at the genetic changes, but one look at genetic changes that you are born with, and the other one look at genetic changes in the tumor that cannot be inherited. So to know if someone can have both tests, yes, because some of those tumor testing can pick up genetic changes that you are born with. So the report will mention that and recommend this time a genetic testing to be done. And someone who is not treated for cancer cannot be asking for tumor testing or tumor profiling. They can qualify for genetic testing instead, but not biomarker testing.
And those are incredibly important differences. So thank you for taking the time to go through all that. But we're going to shift gears just a little bit. So starting a conversation with the healthcare provider about genetic testing can be difficult. So how can families approach this topic? Who should patients ask about genetic and biomarker testing, and when should they ask?
Yes, this is a very good question. So anyone who's interested in genetic testing, based on the family history or personal history, they should share the concern with the doctor at any time. And they can ask either the primary care, anyone in the care team to refer them to a genetic counselor. So they can say something like, I've been diagnosed with cancer, or I have a family history of cancer, and I need to talk to to someone to see if genetic testing would be something that would be helpful. And that would be a good time to provide details about the cancer, the type of cancer in the family, and the ages of diagnosis in that family. So one reason why you want to ask your provider is that some center or insurance may ask you for a referral. So you really need to ask your provider that. And if, for example, you need help finding a genetic counselor in your area, you can find a genetic counselor looking at the website, the nsgc.org website. By using your zip code, you can find genetic counselor in your area. For biomarkers testing, it's usually ordered by a physician who will determine the benefit of the testing and how to use that testing for result for your treatment. So it's really the doctor that will determine if it's something that you need because it's specific to a treatment. But if during the course of your treatment, no one has mentioned that, you can bring it up and ask your doctor if they think that tumor testing will be beneficial.
Okay, great. Can you mention that website one more time?
Yes. So it's the nsgc.org, which is the National Society of Genetic Counselors. And there's a link, find a genetic counselor, and then you enter your zip code and it will tell you where who is in your area.
Okay, great. Thank you very much. So Fabienne, Black Americans face greater barriers in access to critical testing services. What are some of these barriers, and how important is equitable access to genetic and biomarker testing?
So some of the barrier that I can think of is first knowledge about testing and education about those testing. Some people may not even know about genetic testing to even ask about them. And if they are offered, they don't know when they are offered, what is it for, they are not educated about that. Some people may not also know about the family history. It's a secret that some people don't like to share their information, so they may not share with a family member that there's cancer in the family. So it's something that needs to change, where people need to talk more about this type of situation. Another reason is that sometimes we do offer genetic testing or biomarker testing, but they decline. Patient decline just because for several reasons. Because they're concerned about the cost of the test. They may not know how much or if insurance company is going to cover it. They worry about losing health insurance after testing. But the thing is, there's a federal law called GINA, the Genetic Information Non-Discrimination Act, that protects from genetic discrimination by the health insurer or the employers. So people really need to be educated and go to information. And also, patients may not trust the system, the medical system, because they are suspicious that there's a hidden agenda, that they will be using the genetic information for something else. Or some people living in rural area may not have access to that. And then talking about the importance of equitable access to genetic testing is crucial. And so that we can ensure that the Black community have access to the promises and benefit of what those tests can offer. Because we are in the era where we're talking about precise medicine. So it's something that we should really think about. And these tests can tailor treatment and prevent disease in some people in the family. So for genetic testing, for example, it can identify unaffected at-risk individual that can prevent cancer and find cancer early, so that and that will reduce cases of patients dying from cancer in our community.
Fabienne, thank you. All of these points are so incredibly important because this helps us better patient outcomes in the Black community. So thank you so much for sharing that. Fatima, I can't thank PanCAN enough for all of the support that I received during my own cancer diagnosis. But Fatih, I'd love to talk to you about PanCAN's role in supporting patients with pancreatic cancer.
Thank you so much. I think our amazing case managers within patient services really help support patients throughout their journey by providing information, education on things like treatment options, clinical trials, side effect and symptom management, diet and nutrition, genetic testing and biomarker testing, as we just talked about, locating specialists and many other topics. We also can help connect patients to resources and really work with them based on what their situation is, what their needs are. We want to support them in whatever way that we can and in whatever way they may need support. If that's answering questions, concerns, just helping them find information as well. We do additional research for people as well on topics if there is anything that they want more information on. I think we also play a really important role in helping patients feel empowered and also talking to them about ways that they can really advocate for themselves as it relates to their diagnosis, their treatment process, testing, and all of those aspects of cancer care that are critical. Being informed is really important during the cancer journey, and part of our role is really helping patients and caregivers through that process. And then part of my role is really making sure that we have resources available to patients and caregivers and resources that they can really benefit from, like our Know Your Tumor Precision Medicine service, our clinical trial finder, our patient registry, all of our wonderful educational materials. And we're constantly thinking about ways that we can improve our resources to make sure that we can better support the unique needs of the community.
Thank you so much. So in your work with PanCAN Patient Services, you are interacting with patients every day, helping them navigate challenges. What are some common barriers that you find that Black patients in specific and their loved ones experience when they're facing pancreatic cancer? And can you talk about any specific programs that might help them overcome some of these barriers?
Absolutely. So some of the overall barriers that we see include access to pancreatic cancer specialists, as my fellow panelists talked about, access to genetic and biomarker testing, clinical trials, and even just being able to connect with doctors that they feel they can trust and feel supported by. We know also that Black patients aren't receiving biomarker and genetic testing at the same rate as other populations. And so we know that testing is critical in understanding treatment options and helping to improve outcomes for patients. We also see some barriers related to financial and insurance issues, including insurance eligibility, coverage, difficulties with cost of living, medication expenses. And some patients just really need information and really need to learn more about pancreatic cancer, the treatment options, and all of the aspects of the disease. As I mentioned earlier, I think we play an important role in making sure that patients understand their options and advocate for themselves. I think that's one way that we support the community. I think that we also want to make sure that we're continuing to create awareness around pancreatic cancer and our services among the Black community. The other thing that I think we support patients with is all of our programming. So Know Your Tumor being one of our programs where we provide that biomarker testing. We cover the cost of those tests, and we really want patients to benefit from that. We also have a financial navigation program through our partnership with an organization called the Patient Advocate Foundation. We really want to make sure that if patients have financial and insurance barriers, that we're helping them overcome those. And then we have our other programming, our clinical trial finder. We can help patients locate clinical trials and many others. And I think we also want to make sure that we continue to work with the community and with partner organizations that have strong ties and connections, because we want to make sure that we provide more hands-on support to those who need it, especially around clinical trial enrollment and access to testing. And that's something that we're actively working on expanding our services for.
Awesome. So I have one more question for you. Health equity means everyone should have an equal opportunity to live a healthy and vibrant life. What excites you most about what PanCAN is doing to improve outcomes for Black pancreatic patients in the future?
I've been with PanCAN for many years now, and I've seen some really wonderful progress. I think something that I'm really excited about is that we continue to strive to improve the services that we provide and make sure that we're reaching communities that are disproportionately impacted by pancreas cancer. And we really want to learn from the Black community and from other communities and adapt and expand our resources in different ways to better meet the needs of those patients and families. I think within patient services, we're working on continuing to incorporate health equity principles into everything that we're doing, into our educational materials, into every project that we lead, every resource that we offer. I'm really excited about that. I'm also excited about working on ways to really provide more direct and hands-on support and really improve the way in which we deliver and form connections with the Black community. And I'm excited to continue to create awareness about pancreatic cancer. I think we should always approach these topics with humility and with compassion and with an openness to truly learn from the community.
Thank you so much, Fatni. For this last question, I'm going to ask you, Dr. Mitchell. Black patients often don't feel heard by their healthcare team. What can providers ask their patients to help them feel more heard?
So I think that for patients, we need to, and I'm going to talk about what the provider should do first, because I'm really focused on what the provider needs to do. And that is sit with the patients, ask them what they want to know, give them information on the clinical trial, verbal information, and that can be added with written information, and then show them the areas where the written information might be important. Ask them for the opportunity for them to call back. One of the patients told one of the nurses working with me, that they really appreciated the fact that they always got a call back in a reasonable period of time when they called into the office. So really understanding the patients and their needs and allowing the patients to form a relationship with the healthcare team, with the doctor, and in making sure that we are available to the patients, and all of that increases the trustworthiness of the institution. So I think that, in summary, we really have to focus on the healthcare institutions, the healthcare providers, and making sure we are attentive to the needs and the wants of the patients, so that they have enhanced trust in the institution and the providers, and feel that they have a committed relationship with the healthcare team and that we will take care of them.
Thank you so much, Dr. Mitchell, for your time today. Thank you so much to all of our panelists for taking the time to join us today. And thank you to all of you for being here to listen, to learn, to ask questions, and to help raise awareness. I know firsthand just how valuable PanCAN is for patients and families. Your donations and your time make it all happen. Please visit pancan.org to donate. We can't do it without you. Remember that PanCAN Patient Services can help patients and caregivers navigate any of the questions we didn't get to today. Contact PanCAN Patient Services and a case manager can help you. And PanCAN Purple Stride is right around the corner. I am walking in honor of my dear friend Mark and the Gel Strong team in Indianapolis. I encourage you all to join an event in your area. Please visit purplestride.org to register for the big day on April 29th. Thank you again, and have a great afternoon.